Good afternoon, and thank you, Leslie. My name's Helen Barlow, and I'm really sorry that I'm unable to join you this afternoon. I'd like to say a huge thank you to all of you, not only for joining the call today, but for all that you do for our Greater Manchester residents and all that you continue to do through these extraordinarily challenging times. It's really important that a GM Primary Care and Community Nursing Forum creates space for you to hear firsthand about what's going on nationally and locally, and also that you have a chance to learn and take time for yourselves. Since March, as the COVID-19 pandemic has spread within the UK, primary and community care especially have had to make significant changes to the ways in which they offer services to their registered populations in order to reduce the spread of the virus. This will have impacted on you all. You will have all had to alter your practice to reduce footfall into surgeries, decrease routine face-to-face consultations, and rely on technology more than ever to do your jobs. This is against a personal backdrop of worrying about personal safety and the safety of your own friends and family. You may have felt anxious and nervous, and also may have worried about changes to your nursing practice. But your ability to maintain some semblance of continuity and normality for patients during COVID is incredible. And as we welcome the national vaccine rollout across the country, we must always keep quality at the fore. There can never be any acceptance of poor care, and that is where your clinical leadership is critical. I am positive that when we do finally look back at how we worked in this pandemic, we will be amazed at some of the innovative practices, extended roles and collaboration that we developed and initiated, and you will all see that you made a valued contribution to patient care. You have a fantastic afternoon ahead. Leslie, thank you so much for orchestrating such an inspiring agenda, and thank you to our speakers for supporting us. Please look after yourselves and look after each other, and enjoy the rest of the forum.
Thank you, Helen, for that. I'm sorry for some of you having some problems there. If you didn't hear that, it may be the volume setting on your computer that's the issue. I think the majority of people probably heard that. If there is an issue with everybody, then we can try and run that in the break if you'd like that. If you just let us know through the chat, please. So no truer words spoken than from Helen there about looking after ourselves and our own well-being, especially at this time. And that links really nicely with our next guest, who is Kate Friedman, a consultant clinical psychologist. Thank you, Kate. I'll just let you get on with it now. Thank you.
Okay, thanks. Thank you, Leslie. Thanks, everyone. Claire, I think you've got one slide which just has our contact details on it. One thing I'm just going to suggest before I introduce myself is nobody uses the chat just during the next few minutes. You've only got me for about 5 minutes, but the chat is binging, and I'm about to do a really short wellbeing practice with you, which it would be great if we could minimise all the background noise. Right, brilliant. Thank you, everyone. So my name's Kate Friedman. I'm a consultant psychologist at the Greater Manchester Resilience Hub. Some of you may know us. We were set after the Manchester Arena bombing in 2017 as an all-age psychology-led service to work with anybody impacted by the arena. Since then, we have been funded in the last year to offer a wellbeing service to any health and social care professionals working, living in Greater Manchester. And that can include your families, your children. We, well aware of the massive strain under people who are trying to juggle so many things, hold down jobs, and as well as homeschooling. So we are also around if people would like to speak to any of us. We're all mental health clinicians. Our number is on the screen, the 0333 number, and we can also be contacted at gm.help. But you've only got a few minutes with me today. I've been invited here to do a really short practice with you, focusing on well-being. One now and then one, I think, around 2:15 at the end of the session as part of the focus on kind of well-being and self-care, which many of us have to probably confess that it's all too easy to neglect in recent times, with the massive pressure everyone's under and all the different jobs they're doing, juggling plates, multiple roles, and just the general stress and disquiet that people are feeling and high levels of anxiety. So this is a practice that will only be a couple of minutes, and you can take part in as much or as little as you like. It's important to say, as clinicians, we wouldn't normally okay, the chat is still binging, by the way, so people are struggling, sorry if they can't hear. Yeah, it's important to say we wouldn't normally do this kind of practice without knowing more about our audience. So I'll just say this, that you can take part in as little or as much as you like. You can stop the practice whenever you like. I might suggest you close your eyes at some point. You don't have to if you don't want to. You can just kind of have your gaze a bit lower. You could even hold a small object if you prefer, just to focus on that. I also appreciate some of you are sitting in shared offices. You may feel like you can turn your chairs away from each other if you want a little bit of time, or you might be able to close a curtain. But I appreciate it's not necessarily ideal for all of you or any of you at the moment. So the first thing to do is simply minimise the disturbance you may experience over the next few minutes, whether that's muting your email alerts or turning off phones, and certainly muting the chat function here. If you can shut doors, please do. And I'm pretty sure everyone's kind of on silent now as well. Those of you who are in the luxurious position of being able to lie down, if you're at home, by all means take a few minutes now and get yourself comfortable lying on your sofa, or if you're on your bed. The rest of us in seats, just trying to get as comfortable as possible for the next couple of minutes. Okay, so as you sit here, let's just begin by taking a couple of really simple deep breaths. Just want you to fill your lungs, really feel the air filling your lungs, and then letting all of the air out. And if you are comfortable at this point, by all means do close your eyes, or certainly lower your gaze. And again, just fill your lungs, slowly filling and noticing the feeling as your whole body lifts, filling with air. And slowly letting it out again. And this time noticing any tension you might be holding in your shoulders, in your neck, or your jaw. And with your next breath, see if you can just let that tension go. Just soften your body, soften your jaw. Now let your breath return to its own natural rhythm. You don't need to do any more than that. Your breath will just continue. So let it do that, let it just be. And notice the rise and fall of your body as you breathe in and out. Some of you might like to place a hand on your chest, or you might like to place a hand on your belly, so you can really connect with the movement of your body as you breathe in and out. Remembering that our breath is always there for us to come back to, creating a natural rhythm and connection to ourselves that can anchor us in the here and now. Something we can come back to time and time again, wherever we are, whatever we're doing. And we can use our breath as a way of refocusing ourselves to the here and now, anchoring ourselves in the here and now, when nothing else matters in that very moment. And of course, you'll notice there are plenty of distractions from this anchor. That's to be expected. Just acknowledge these distractions, knowing they are a normal part of our busy lives and our busy brains. When you can, just come back to your breathing and the rhythm that you can feel as your breath moves in and out. Come back to it and resettle yourself in the moment. You might have to do this a number of times as you notice distractions. That's fine. And now, as you get ready for this afternoon, this next 90 minutes, here together with your colleagues, just notice what it feels like to have all been brought here together as a collective, connecting in some way to a wider community of frontline professionals. Just let that sit for a moment with you, bringing to mind the compassion and commitment of your colleagues who sit with you here today. Their strength and their courage, their skills and their experience. And maybe now, as you sit together over the next 90 minutes, you can take a moment to slow down, to reconnect with your own skills and strength, and just share a moment of connection with your colleagues in these very, very strange times, knowing that you're all doing the best you can under these circumstances. And so as we begin to end this practice, come back to the anchor of your breath, the rhythm of your breath, noticing the rise and fall it creates without you having to do anything, try anything. You are just here in this moment. Slowly now taking some longer, deeper breaths, letting your attention expand out to the rest of your body, to the sounds around you. Maybe starting to introduce a little bit of movement to your fingers and your toes. And on the next breath, opening your eyes, having a stretch or a yawn, maybe moving a little bit, and bringing yourself back to this moment now, ready to move into the rest of your session. Okay, welcome back everybody, if you've had a moment there. So that was a couple of minutes, and I wasn't going to take any Q&As. If people have got questions, you can certainly hold on to them if you prefer, and ask them a bit nearer the end of the day if I come back for the next session. I do have another slide I just wanted to share. Claire, I don't know if you can just move to the next slide. So I just wanted to flag up, those of you who've got smartphones, you can just scan those codes there, and they'll take you to two really lovely similar breathing exercises, but with video YouTube clip that goes with it. They've been made by Dr. Sarah Meakin, who is Head of Psychological Services over in Belfast. And they're really made for frontline staff who are transitioning into work and also transitioning home from work. And if you are interested, they're only a couple of minutes, but they're well worth checking out. Sarah's got a lovely voice, and they're just, yeah, if people are interested in kind of thinking about their own well-being, they're a couple of minutes of your time. And I think at the moment, squeezing in these little extra minutes, if they're to look after ourselves, not better time could be spent really. So do check them out if you want to. So thank you very much for your time. I will be back at 2:15, I believe, to do another really short practice. And I hope you enjoy the rest of your session. Thanks.
Thank you, Kate. That was lovely. Thank you. What an opening, and what a great way to start a forum. Thank you very, very much. Tips for life then, not just for now. That was great. Thank you. I'm really, really pleased and delighted to introduce our next guest. Sam is a local nurse. She won't mind me saying that. And she's the head of community nursing for NHS England and NHS Improvement. And she's joining us this afternoon to discuss the National Community Nursing Plan. Welcome, Sam. Thank you.
Thank you, Leslie, and thank you so much, Kate, for the beautiful session that we've just had, and hopefully I can use the good vibes that are here now, very relaxing, to talk to you about the National Community Nursing Plan. So you can hear, thank you to Leslie. I am local, I'm in Bolton, and I'm a Greater Manchester girl, as you all know. And I'm part of the national team, and have been in the national team for many years. And I currently, I've got some slides. I'm not going to get through all of them in 15 minutes, but the plan is that you can have a copy of the slides and you can have a look at those, and there's loads of email contact details, and you can be in touch with me afterwards, and I'm happy to take any questions. So, and thank you so much for inviting me. I love coming to Greater Manchester meetings. I feel a real sense of belonging. It feels like home to me. So yeah, I'm really chuffed to be invited. So I'm not sure who's sharing the slides, but I'll continue to talk. So in 2019, Ruth May, as you know, our chief nurse for England, committed to the development of a national community nursing plan. It is the commitment to look at community nursing broadly, not just district nursing. It is the whole of the community nursing family. And on the back of that, we've started to think in a time of pandemic very carefully, slowly behind the scenes where people have got energy and a commitment to do so. We've started to think about what that plan will look like for the next 5 years. So I just want to take you on a bit of a quick whistle-stop tour around where our planning has come up to, and if we've got time, we've got a film that we've just many community nurses have made that I just want to finish on, so we'll play that at the end. Okay, next slide. Thank you, Matthew, or whoever's controlling the slides. Okay, so there's my contact details. I also hold Head of Year of the Nurse and Midwife 2020. World Health Organization said this is our year, and it's also our year this year. And I think nurses have demonstrated their strength, their professionalism, and their absolute pride and joy in what they've delivered during the pandemic. So, you know, we need to take time to remember those nurses and midwives who have sadly died, and we also need to recognise the tremendous efforts across the whole of the nursing midwifery family and care staff, of course, to the pandemic. Next slide, please. Thank you. So very quickly, for you to see, Ruth May is incredible to work with. Karen's story is coming later on the agenda. Karen and I are really pleased to work with Ruth. These are her priorities. There'll be no surprise there to you. And I'm really pleased that we've started with Kate around staff health and wellbeing. That's really important. And clearly vaccination is up there. And as nurse leaders at all levels, IPC, you are our IPC champions. And, you know, you are demonstrating that incredible leadership locally in your clinical practice and in teams, and reinforcing that with your patients and families. So thank you so much for leading those priorities forward. Next slide, please. Ruth has created a COVID, learning from COVID platform called a Catalogue of Change, and we're gathering case studies. They're not long, a few hundred words of best practice, of things that we want to keep, the things that have been really good about the pandemic, where we've innovated, changed services, changed the dynamics of the patient-led care, and really invested in our staff to make this better. And we want to hear those case studies. There isn't a way in which we can scale up and share that change quickly, and this is through the catalogue. So if you've not had a look at the catalogue, please do so. And more importantly, I would love community and primary care nursing examples added to that catalogue of change, because, you know, the more voice we hear in recognition of the efforts and the services that you've led. Next slide, please. Our joint challenge is big. The challenge, as you know, you're working in practice every day, and you know, particularly for the elderly. So when you do have a moment, I don't suggest you read this after that beautiful, relaxing session we've had, but you know, when you've got a little bit of headspace, have a think about looking at this report from Age UK that was published in October, and you know, the issue is quite stark. You know, the research uncovered lots of things that we will know about our population, about examples of depression and the loss of hope and the low mood, lack of support, physical and mental health deterioration of our patients. So, you know, we have got a lot to do to help and support them, their families and their loved ones and their communities. Next slide, please. And the leadership challenge, there's loads of papers about IPC. Nurses do this wonderfully well all the time, and you are our eyes and ears. And, you know, almost a year later, people can get a bit fed up of doing good IPC. So we've really got to remain tenacious and leaderly in our discussions and challenges to make sure, you know, IPC remains at the top of the agenda and complacency doesn't set in. So, you know, thank you for everything that you're doing to support that, and nurses are our biggest advocates, and it's so important to maintain vigilance. Next slide, please. And as Kate has mentioned, your health and well-being of yourselves and each other is absolutely paramount. And we know Kate has covered that beautifully, but I just wanted to point out that there was extra investment made for nurses, paramedics, therapists, pharmacists and support staff. So, you know, there is lots of support out there for us to tap into, and those resources that Kate showed earlier, absolutely fantastic. Thank you. Next slide, please. So this is a film. I'm going to come back to this if that's okay. We'll play that at the end. So I just want to talk to you a little bit about the community nursing plan. So we've started to set out what we want to think about, what will go in the plan, and this is our outline structure. So for me, everything is grown from bottom up. So, you know, we know community nurses know what needs to happen and change in the next 5 years. Their community nursing's working in that community setting all the time. So that practitioners network is really fundamental. We estimate we've got around 80,000 community nurses in England working in various different services across homelessness and, I don't know, prison outreach services and mental health, learning disabilities, specialist nurses and so on. I mean, the amount of services. So we've started to think in that space about nurses who work in out of hospital settings in terms of describing their community, and I think that's in line with the RCN Community Nursing Forum that describes it very similar as well. So the National Board for Community Nursing is yet to meet. We haven't pushed for that board meeting because obviously we're in level 5 pandemic and it can wait, but the other groups we've started to form, and the clinical reference group particularly meets quite regularly. We have representation from all the regions, the chief nurses from regions and directors of nursing from community organisations. We've got some academics, some CCG clinical commissioning chief nurses, RCNs there, and so is a Q&I. And we've also got support from medics, pharmacists and allied health professionals at national in the national space. The Shared Professional Decision Making Council is getting up and running. So this is very important to Ruth, her councils that feed in the staff nurse view. So we've got some clinical fellows working with us who are just incredible, and one of the clinical fellows has chosen to set the council up, which is going to be great. And we'll be doing expressions of interest for staff nurses working in community. We're aiming for band 5, band 6 level of nurse who are patient facing, obviously, to join that council and to feed directly into the national board, which will be really quite powerful. We've got a community and people's advocates forum, which is where we are generating our voice, our patient and public voice from those community groups, small, large, little groups, those volunteers, those associations that make such an impact in our community settings and are part of our community assets. So again, they need to feed into the national board and to the plan. And we've also got a stakeholder advisory panel, so charities, Hospice UK, lots of big charities, small charities, organisations, associations, academic groups, number who are feeding into the stakeholder advisory panel. And we're going to organise ourselves through 7 regional operational groups, so that then it will be kind of regional determined and prioritisation according to each regional need, devolved system leadership model. And we are connected into NHSX, and we've got task and finish groups going. We've got lists of projects already in flight, and we've got some core principles there down the side, things like inequalities and care, delivering care where patients choose to have their care delivery and so on. Next slide, please. So while we've been developing this and in the engagement phase, we've been asking people for 3 wishes. So what would be your biggest 3 wishes for community nursing over the next 5 years? And I really want you to use a chat box, so share with us your 3 wishes. Email me, the emails are on the slides, and let's hear your wishes, because we need to engage with thousands and thousands of nurses and ask them what they're thinking. What I show you here is the themes that are emerging from the wishes so far. So they're not in any hierarchical order, but you can see the themes there for yourself. It is quite significant. Each one of those will take lots of effort and energy to really go for it. And we're still building the themes, because there's more wishes coming forward. Next slide, please. So these are the projects that we've got in flight. There are a number of projects that we have going at the moment, and I don't want to talk about them all because there's just too many, but there is slides about these behind. Safer Nursing Care Tool, if we just think about that for the moment, that is about having a tool which, similar to the hospital Safer Nursing Care Tool that was developed and is hosted by the Shelford Group, so that we can look at what is safe in community nursing settings, and we're comparing apples and apples. So that's in development at the moment. We've got 15 organisations from across England coming forward, and who have come forward, and our alpha group, and then we're going to do some beta testing with the project, with the tool afterwards, before launch. So, and as I've said about the data, we've got so many impacts of data, but I've still not got a full picture of how many community nurses we have, how many vacancies do we have, how many do we need, how many are due for retirement, how many do we need for the future, and so on and so forth. What's the sickness rate, absence rate, where's the vacancies? So we do need to build that community workforce database more strongly, and then we'll be doing some engagement, building the ambition, as I've talked about, engaging further with people and so on. I mean, the practitioners network, I would love for you to join, so please do be in touch if you would like to. Next slide, please. So the next few slides show the projects in a bit more detail. So when you get them, you can have a read through them, because obviously I'm just cantering through now. So keep going, Matthew. Thank you. And I wanted, before I showed you the film, I just wanted to end with a huge thank you from me and from Hilary Garrett, who's a Deputy Chief Nursing Officer, who is also a Greater Manchester nurse, and from Ruth to say a huge thank you for being a rainbow in someone's cloud. You have brought so much fantastic care and brilliance during the pandemic, and that is definitely recognised. It's definitely seen and heard, and a huge thank you from us all. And the next slide, I just wanted to ask you a few things, but we can leave that up while we do questions. Matthew, could you just play the film, please? That'd be fantastic. Hopefully you guys will be able to hear it.
I am proud how we worked as a team during the COVID-19 pandemic and how we kept our patients safe. In the beginning, we were unsure and worried. However, I am glad that we pulled together as a team to keep our services running. We had redeployed staff from other services, and this was a great learning experience for all of us. Thank you.
What I am most proud of during COVID is the way teams have integrated and worked together within the community with health, social, the third sector and voluntary services to support people to stay at home and live independently and safely. During COVID, it has been devastating and challenging, but the way teams have really integrated together has been humbling, and I am very proud to work within the community of Warrington.
I think one of the most important things for me that's come out of this pandemic is that it's united and unified so many people who weren't originally working in healthcare or have no healthcare background in understanding and preparing and doing what's necessary to help fight infections, in this case COVID. So that's probably the prime factor that I've learned from the pandemic. It's unification of people across the world in fighting infection.
What I'm most proud of during COVID is the work of children's community nursing teams who carried on our hard work in supporting early hospital discharges, preventing hospital admissions, and balanced that with keeping everything as normal as we could for children, young people and families who were shielding at home. We may be a small workforce, but we've shown we are mighty, and we want to carry on raising the profile of what we do so that we can future-proof our services.
I am so proud of the way the District Nursing Service so quickly and readily adapted to ensure the safety of ourselves and others, whilst we continue to deliver the same high standards of care to our patients in the midst of a pandemic.
What am I most proud of during COVID? I think for me, it's the kindness that I experienced from the community of Dorking, where I live and work. A community that, despite being behind closed doors, staying safe and keeping at home, made us feel really appreciated. Those dark days where we really had to dig deep to find the strength to work were brightened by the rainbows in the window, the smiles and waves from afar, and the applause on the Thursdays. Thank you, Dorking. Thank you for your kindness.
What I'm most proud about working through COVID is just how resilient the district nursing teams have become. Our workload has become massive, and we've had to support other teams, other areas, and each and every staff member has stepped up and worked so tirelessly to maintain the safety and independence of patients wanting to stay at home and supporting families in such challenging times.
So the biggest thing that I'm proud of over the last few months is my colleagues, the way that we've pulled together. We've all needed to do some scary things, some things that we weren't particularly used to doing maybe. We've done some interesting things and some fun things and had some real successes, but we've really pulled each other through and got each other to the other side, and that's what I'm really pleased and proud to be able to say.
I know the pandemic has caused many people, many patients, many relatives so much of distress, but I take great privilege in helping those patients and relatives out during the horrible times. We had half working from the office and half working from home, and it makes me really, really proud to be part of the team.
So that's it. Hopefully you enjoyed the film, and I've just put in the chat box, please be in touch with us. Leslie, hopefully that's on time enough for you, and I'm happy to take a couple of questions, or I can hang about and answer questions in the chat box if you would like, whichever you would like me to do.
Hi Sam, sorry, we have got a couple of questions in the chat box. Do we want to go through those now, Leslie?
Yeah, I think we've got time for that, Dawn. Yep.
Wonderful. Okay, Sam. So we've got a couple of people who have spoken about the 3 wishes that they would like. One person has said that
unfortunately, they would like to be respected and treated like medical staff. Patients need to treat people with respect. This has increased during lockdown. The patient respect for people has decreased, and they don't have much patience at the moment. Possibly that's something that we could pick up going along with things about how we can get people to realise that practice nurses, are a vital part of our workforce, I think is what one person's saying.
So I'll take that first. Absolutely, I agree with that comment that's been made. It's a really good point. And so you'll see on the themes that are emerging, there is a theme about respect and recognition and profile and value. This is about us championing and supporting the work that primary care community nurses do every day, and to put that into the public arena. And we've absolutely done that during COVID, where people have seen that and people who've received care. However, there will always be those exceptions, and I guess one of the things, this is where the People and Community Advocates Forum will be really powerful, because I think there are champions in that patient voice, patient space, public space, to say, we need to be recognising the effort and contribution that these nurses are making, and to support them, not make their lives harder. And I guess we've seen that with some of the celebrities as well. Is it Michael Rosson? I don't know if I've said his name correctly, the children's author, and he's said publicly about his support for nurses having had COVID and being treated by community nurses. So I think it's getting the value and recognition of what happens in that out of hospital space, and how fantastic those nurses are that work autonomously in their practice every day.
Thanks, Sam. One of the other questions that we've got from a few people is that there is no specific feedback from general practice nurses.
In terms of?
I think on the film, Sam. There's nothing about from the practice nurses, and they feel a bit forgotten.
Absolutely. So so let me tell you where the film came from. The film was a shout out on Twitter. So I did a shout out on Twitter, because there is so much national communication going out at the moment, that it was just from my personal Twitter account. And I just said, anybody wants to do a quick film to your phone or iPad or a gadget of some sort, and then send it to us, we'll put it into a connection. Anyway, it's a pinned tweet, so you can send them in whenever you want. So we just took the first 6. Is the 6 in the film or 7? I can't remember. So it's the first 6 or 7 that were sent to us, and we put them together in a string. So we've got many more, and obviously, my plan is to have 80,000 more, really. So let's make more films. Let's make a practice nurse specific one, if that's what the comment is saying. I think that'd be absolutely fantastic, and it's not hard to put together. And these were individuals that just emailed us those, and it was quite interesting, because Matthew and I actually got a film sent to us from a nurse in Northern Ireland as well. So we're getting them not just from England, we're getting them from wider UK. So there is no intentions to exclude anybody here. I am definitely keen to support all.
Oh, thanks, Sam. I think that's a call for us practice nurses to inbox Sam with our tweets there, everybody. So get them sent in to Sam.
Thanks for that, Sam. Thanks for answering those questions. That's great. I know we've got a few more there. It would be good to know how we get involved with that, and how perhaps we can do a practice nurse video of the same. We're all working hard out there, vaccinating and doing other things at the moment. It would be great to show that, to demonstrate that.
I would pick that up with Karen. So I'm sure Karen would be very interested to help support do that. So if you pick that up with Karen, I think she's coming later in the agenda. But yeah, Karen and I work very closely together, so I'm sure that's something we can support, definitely.
That'd be really good. I'm sure we'll get involved here. Yeah.
Thank you for inviting me, Leslie.
No,
and
it's been great.
Lovely to meet you all. All right,
no,
thank you for your time.
It's really nice, and thank you very much for coming. We really do appreciate your time. Thanks, Sam. Thank you. Okay, so if we move on now, next on the agenda is Jo Howarth. I'm really pleased that Jo can come and give us an update now on the COVID vaccination programme. So thanks, Jo.
That's great. Thank you, Leslie. Can you see me?
Yes, Jo, we can see you.
Good. I can see myself now. That's great. Good. Thank you. And I hope you can hear me. So yes, thank you very much, Leslie, for inviting me to join this forum. It's been really fascinating so far. I've really enjoyed listening to the previous speakers. Some of you will have met me before. Most of you will be aware of the team that I work in, the screening and immunisation team in Greater Manchester. But just by way of an introduction, so I can introduce myself to you. My name is Jo Howarth. I'm a screening and immunisation manager, and I work, as I've said, as part of the screening and immunisation team. Now, as a team, we are here to support all colleagues, all healthcare professionals with the COVID-19 vaccination rollout across Greater Manchester. And we're very much our emphasis around working with you. So please do contact us if there's anything we can help with. I'm a nurse by background, and I'm currently working closely with Leslie, our chair of the meeting today, and Tracy from the nursing quality team, which is Helen Barlow's team, who gave the first session today. And we're working specifically to support the national rollout of the COVID-19 training for all levels of staff. So I know you will have heard something about the progress that's being made and the support that's available through Leslie. I've also become involved during the pandemic with the Greater Manchester COVID-19 Workforce Hub, and as well as support for the Mass Vaccination Centre, primary care support, and also locality CCG and local authority lead support. So I know a little bit about a lot, but not a lot about most, if you know what I mean. We've sort of been spread very thinly. The subject, as you know, is vast and extremely fast-paced. This immunisation programme has been rolled out at an incredible rate, and I'm really learning with it as you are. We're all sort of learning as we go along, and I'm most certainly not the world's expert, but I do think that between us we can all help each other to work it out and progress this incredible vaccine rollout programme. The screening and immunisation team that I work within are available for information and advice, as you will know, for any healthcare professionals. We have an inquiry email line available if ever you need any questions answering or anything that you're uncertain of. Please do use that, and I'll detail the email address at the end of my session. We take the philosophy that no inquiry is a silly inquiry. If something's bothering you or it's on your mind around the COVID-19 vaccination programme, please feel free to email us at that line. We're more than happy to help you. It is so hard for us all to keep up, so the line is there for us all to scratch our heads, take a bit of time and try and support you going forward with this enormous programme. In light of all of that I've just said, I'm going to really struggle to take questions on the day in this session, and that's because the guidance and advice is changing so quickly, and there is so much of it, and I'm also fearful that I might run over time if I take questions on the day. But what I would really encourage you to do is use the chat box, ask away anything whilst I'm talking that comes to you around the COVID-19 vaccine programme that you've got a question about. Please put it in the chat. And after this session, we as a team will formulate a question and answer document that will be sent out to all of you. So that makes sure that everybody's questions are answered and everybody hears the answer all at the same time. So please do use that chat, and I'll pick those up later. In addition, we would also love to hear, and I know previous speakers have talked to you about this, we would absolutely love to hear about any top tips you've got, any successes, challenges, any solutions or workarounds that you've managed to achieve, any ideas you've got, or any lessons that you've learned that you think, if I was doing this again, I wouldn't quite do it that way. It's really helpful for us to learn from you how things are going in action, and we can share those with others so that that learning and understanding is shared. And very much, as I've said, we're all in it together, and I think if we can share our experiences, it's really helpful. So again, any contributions that you've got that you think would be useful to share with other community nurses in Greater Manchester, please email them into our inquiry line. As I say, we will have the email address at the end of the session. So I have got a couple of slides to show you now with what I think might be the hot topics for community nurses with the vaccine rollout. But I do have to say again that the slides come with an enormous caveat. The guidance changes so often, so frequently, and by the end of this session, it may all have changed again. So there is a really big caveat, and please bear with us. And you know, it is so difficult to be certain of anything with this vaccine programme as things go on. And please do just keep alert for changes going forward. Okay, so I'm going to try and share my slides. But Claire, please do help me if I fail miserably. Can you see those?
We can, yeah.
Brilliant. Oh, success. That's lovely. Okay. So these are just a few things I want to go through with you today. But this is the first slide, which looks like the last slide, but I really wanted to put this on at the beginning. I'm echoing all the speakers of today. It really is massive, massive thank you for all that you've done to roll out this vaccine programme. We fully know that without your willingness and your ability to rise to the challenge and prioritise this massive public health effort, we wouldn't be anywhere near where we are now. So thank you so much. We know and recognise that it's over and above your day job, and the appreciation from our team and from the Greater Manchester Partnership is really heartfelt. You know, it really is a sincere thank you to every single one of you. And as you can see on the slide, we are off to a stellar start. We've really cracked on with it. So, you know, it's amazing. I'm absolutely in awe of the way that things have progressed. And there's more to come as the programme rolls out. But this is where we are now. And I just thought you might be interested to know some of the figures. What I heard on the TV yesterday, you may all have seen it, that 6.5 million vaccines have been delivered in England since the start of the rollout, and that is incredible. 6.5 million, and Greater Manchester has played a really big part in that. Our vaccinations are, as of the 17th, so just over a week ago, we've delivered 188,876 vaccines, and that figure is going up and up every day. And that was roughly broken down to 126,000 at the local vaccination sites, 3,000 at the mass vaccination centre, and 60,000 at the hospital hubs. And I'll just go over a little bit more on the detail of that with the next slide. So the mass vaccination centre, as you will all be aware, opened a couple of weeks ago at the Etihad Tennis Centre in the centre of Manchester. It started with one pod, and one pod could vaccinate up to a maximum of around 500 people a day. Very quickly, that was working extremely well, and they were able to open a second pod within days of opening the first pod, which doubled the productivity. And as of yesterday, and it says on the slides here, due to move to 4 pods, but I've had confirmation today that that did actually happen. So that's 4 pods, which have the potential to deliver up to 2,000 vaccines a day, which is incredible. Hospital hubs. All the hospital hubs are now operational, so your local hospitals will be delivering vaccine COVID-19 vaccine also. And then as of the 18th of January, there were 3 more primary care designated sites opening on top of the existing ones. So plenty of progress and more opportunity to vaccinate the population becoming available with every week. The new news from last week was the 6 community pharmacy sites that went live to add to all of the vaccine opportunities. And the booking process for them will be very similar to the mass vaccination centre. And then just finally, the care homes, which I'm sure a lot of you on this call have been heavily involved in. And a massive thank you to you for all of the hard work that you've put in there also. The ambition was to administer the first vaccine to staff and particularly residents in the older people's care homes in Greater Manchester by Sunday. And I'm really pleased to say that I think we've smashed it. Really good. So thank you so much. You really have gone over and above with that piece of work and on a very, very short period of time. So lots to celebrate and a lot of achievements so far. Okay, so I just thought I would talk to you briefly around the vaccine priority cohorts, as there's been a continuous debate around the priority cohorts since they were released, and they have been changed several times. So again, I would recommend that you keep checking to make sure that the cohort stand. This is the priority cohort list as of the 30th of December. It hasn't changed since then, but please do keep an eye out. So the rationale behind these priority cohorts really is that overwhelmingly it's age and underlying health conditions that are really clearly evidenced to put the whole population at risk. So by working through these priority cohorts, we are being able to vaccinate the most vulnerable first. And it is estimated that if we follow this prioritisation process, we'll be able to prevent 99% of mortality from COVID-19 infection, which is incredible. So the purpose of these cohorts is to prevent death across the whole population, and that's why these have been stated as guidance for priority for the rollout of the COVID-19 vaccination programme. In managing those, currently as of Sunday, and I think I can safely say as of today, I don't think there have been any changes since Sunday, that we are encouraging all areas to offer vaccinations to the cohorts 1 to 4. Now there will still be eligible people who are in the cohorts 1 to 2, and they should be prioritised wherever possible. I believe there was some statistics around about 80% of the over 80s in England have been vaccinated, which is incredible, and they are clearly in that prioritisation cohort. So as we hear more, we will be making sure that everyone is aware of any movement down to any further cohorts, but currently it's the offering of vaccinations to cohorts 1 to 4. And our hot tips or our key rules are: don't waste any vaccine, it's so precious, and you know that is really key to being able to deliver as many vaccines as possible. Provide it first to those cohorts, as we've said, and the second dose should be given at an interval of 12 weeks, which I will talk about in my next slide. I think it's key for us all really just to remember that each dose has got the potential to save a life, and that really is the key to trying to keep any wastage to a minimum. There's a couple of suggestions there that about trying to minimise that wastage. So using a reserve list of people that are willing to attend at a short notice, and just having that set up ready to go for each session that you have. And as I say, if you have any further suggestions or tips around how to minimise wastage, please do let us know. So the COVID-19 vaccines. Here we've got 3 vaccines now that have been authorised for use in England by the MHRA. You'll be fully aware of the Pfizer-BioNTech vaccine, the AstraZeneca vaccine, and the Moderna vaccine, which has been authorised for use in this country, but it won't be available until spring. And I'm hearing today that that's probably going to be around April, just to give you an idea. Okay, so it's a 2-dose schedule, and originally we set out with a much shorter gap. As Pfizer-BioNTech was rolled out, the gap was stated at 3 weeks, and then there was a massive and very quick change of heart to 12 weeks, which I know affected an awful lot of people in the planning and preparing for the vaccine rollout. The rationale for that is that it is agreed that the fullest protection is achieved around 2 weeks after a second dose. But actually, the first dose of both the Pfizer-BioNTech and the AstraZeneca vaccines, and I'm sure the Moderna, when it's out, are highly effective. And therefore, the decision to delay those vaccines to 12 weeks apart does give us maximum benefit for the most amount of people in the shortest possible time. And those are the current guidance around the distance between the 2-dose vaccine schedule. There is a lot of debate, and you will have heard it on the news around that gap between the 2 doses. So please do keep aware of any changes that you may hear about. Just a quick catch up around the PGDs, which have also caused much debate. There are currently 2 PGDs, or patient group directions, as you will know. Both of these were published earlier this month. Pfizer's was released in December, but was quickly amended and updated and released the day before the AstraZeneca one. So they are both valid from the beginning of the year. You will know that there are different requirements for each of the vaccines in terms of storage and transportation, the dilution and preparation. And the PGDs are actually a really good source for clear information and guidance, and does clearly define the differences between the Pfizer-BioNTech vaccine and the AstraZeneca vaccine. PGDs can be used by the registered healthcare professionals, and that's where the national protocols differ. And I will talk about the national protocols in a minute. But the key news in terms of the patient group directions, really, I think the key thing for us as nurses really is that within the PGD, a 6th dose for the Pfizer-BioNTech vaccine can be given under the PGD as long as it's a full dose. So if you can get a full 6th dose out of that ampule, then you're covered under the PGD to use it, which there was some debate, I think, initially around that. Not to use any of the any partial doses, they should be discarded, but that does give you that option to get another full dose out of an ampule if it's available. And the same key news for AstraZeneca. There's quite variable amounts of full dose vaccine that can be taken out of the ampules because there are different vials containing different amounts. But the PGD also allows for the administration of all full doses that can be obtained out of a vial, and again to discard any partial doses. There is a lot more obviously in the PGDs, but I just thought these were a few key points that might be of interest to you around those. So national protocols, really new to all of us. You learn something new every day, certainly at the moment, and particularly around national protocols. I don't know if any of you are using them currently, or whether you've stopped using the PGDs and using the healthcare professionals. But just in a nutshell, the national protocols give you the option to spread tasks involved in a vaccination process, or it can be followed by one healthcare professional. So there are options within a national protocol. And you'll see on this slide, the table gives you the guidance that's held within the national protocol around that spreading of tasks around colleagues to be able to deliver the vaccine programme. So the stage 1 should always be completed by a registered healthcare professional, but the remaining stages can be a registered healthcare professional or a non-registered person. The national protocols require individual signature and storage in exactly the same way as the PGD, And anybody that is operating under the national protocol needs to agree to the full contents and agree to work within it. And it is the responsibility of each person who signs it to operate under the protocol within the bounds of their own competence. And I think that's really quite an important point with the national protocols. So if you have any thoughts or feedback on the national protocols, as they are all so new to all of us, then please pop that in the chat box, and we'll be able to answer any questions or queries that you might have about those. And as I say, we are really sort of learning as we go along. So just as a final slide, you know, we as a screening and immunisation team are here to help you. We'll scratch our heads with you, and we will puzzle over things with you, and we will really help to try and work things through with you. The email address is for any health professional who's got inquiries, and as I say, we'd love to hear about any top tips you've got. The other thing I just wanted to mention was that if you have an incident or, you know, something that really didn't go well, or an error in the vaccine or a cold chain issue, we really would like you to let us know. We're here to support you, take you through the process and advise you on next steps. So you've got someone to share that with. And as you would do with any other immunisation query or incident, then please do let us know. You know, we're here to help, and we want to be able to help and support you. For those of you that have possibly used the email address before, I think prior to the pandemic, we did hand out a landline phone number also. Unfortunately, that's not in use at the moment. So please do use the email service to be able to help you. And members of the public, if they email into our line, we would then guide them back to primary care to be able to have their questions answered by yourselves. So it really is, it means that we can answer more quickly if we've got that as a healthcare professionals support line. So I'll just finish with these three useful links. Number one is pretty well all you need. It contains links to the JCVI priority cohorts. There's the chapter of the Green Book, the information for healthcare professionals, the PGDs, the national protocols, any leaflets and posters. So please do use that link. There's lots of stuff in there. The second one here is, again, a link that takes you to an awful lot of support and guidance relating to primary care and things, for example, like the transportation of the AstraZeneca vaccine, but lots of things in addition to that. And then the third one is Vaccine Update, which I'm sure all of you are really aware of. A great place to learn about developments in vaccines, any policies and procedure changes, and if you're not already signed up, then I would really recommend that you do. So I hope that's been helpful, and really welcome any questions that you've got in the chat box that I can take away and develop a Q&A for you quickly after this session. And just to finally say thank you again so much. We're all in it together. And we really want you all to take care of yourself. We're so pleased to see the first speaker talk about mindfulness and taking care of yourself. You know, we really want you as well and as fit as possible to meet the challenges for this programme. But thank you so much for everything that you've done.
Thank you for that, Jo. Thanks very much. We have run over a little bit now. If you've got any questions, keep putting them in the chat for Jo, and we'll get that out to you as soon as possible, all the answers to them out as soon as possible. The slides will all be shared with you. So we'll just move on a little bit. We've gone over the break time as well, so I'm afraid if you want a break, just hop off and hop back on. I'm sorry about that. That was the technical problems we had at the beginning. So I'm going to move on swiftly to Kerry. Thanks again to Jo. I'll move on to Kerry Porter. Kerry's going to tell us about an update regarding training and how to register for support for the mass vaccination programme in Greater Manchester. Thanks, Kerry.
Good afternoon, everybody. It's nice to see you all virtually. So my name's Kerry Porter. I'm one of the primary care workforce programme managers. I'm going to talk to you about the digital passport today. So Greater Manchester, I'm sure you're aware, with Joe's team, the immunisation team and Leslie, developed a training document based on the national guidance of the training that was required in terms of the COVID vaccination. Appreciate that actually you do quite a lot of training already and that's around immunisation, and that this is additional work. So again, we thank you for your commitment. I'm going to, for those of you that haven't seen it, I'm going to give you a quick demonstration so you can have a look what it looks like. So we'll use me. I'm clearly not a vaccinator, but we'll use me just so that you can have a look at it in the first instance. You will be able to do this next part, so you will be able to edit once you register on the GM passport. Basically, there is a section that asks about you, asks you to provide your details and contact telephone number and email, your job title, and actually the area that either you're working in or you live in, but that you would like to be signposted to. So I'll be in Bury today. It also asks you where you would like to work. So do you want to be signposted locally, or are you happy to be registered on Lantern? Do you want to support the mass vaccination site? Or, for example, Leslie, who is an immuniser, are you already an employee of the partnership? You can choose more than one, you can choose them all, so it's entirely up to you. It also goes on to then ask you whether you're a current registered healthcare professional. Obviously, this is no for me. But I'm going to have a little play just to kind of show you what happens. So at the moment, it looks like I'm an admin person, and the questions that are presented to you depend on the answers that you provide at the start of the passport. So you can see for an admin person, it's a much reduced list, but it is in line with the national guidance. So I'm going to now say that, yes, I'm a registered healthcare professional, and that, yes, I absolutely want to be a vaccinator, and that, yes, I'm an experienced vaccinator. So don't give me the needle. So hopefully I won't be approaching you, but this is just in terms of giving an example. When those kind of questions are answered, it gives you an opportunity to say when you completed the training, and also gives you an opportunity to select and submit the evidence to support that. Don't know if that's is it gonna let me do that on this occasion? Yes, so it's very, very straightforward. It's a click of a button, and then it's pretty quick that it's uploaded. You can actually provide a PDF, a Word document, or even a screenshot of any training that you might have. So where you might say a no, for example, let's use 2. No, actually, I haven't done that training. It will give you the direct link to the e-learning for health training. So you can click on that. It will take you through to the training. You can complete it, change this to yes, and submit your evidence. So you get the idea. In terms of this particular view, there's a section down here where you could add a note in already. And for those of you that are registered, frequently there's a message in there that's telling us that you're already working with your local PCN and you're already providing vaccinations. From our kind of back office function, we would then go into here and say, actually, you're an experienced and competent vaccinator. We want to fast track you because we want to get you out there. You don't need to attend a webinar because you've completed that. If you do want to, absolutely let us know. We've been told that it's very interesting, and we're happy to signpost that to you. Do you need to train a training pod? As an experienced and competent vaccinator, no, but I am going to come on to that in a moment. And then pretty much, if all your certificates are in place, we can do an exercise in the background that confirms that you're competent and signed off, and then we can add that to your record and put some narrative in there. For those of you that might also be registered on Lantern, it gives us an opportunity to add the Lantern number in there and say that your onboarding is complete if that's the case. I'm not going to say that because obviously that's not true and accurate, but what I will do, if it will let me come out of that, is I will show you that you can actually download your own passport and have it in a PDF. I'm just going to stop sharing my slides now and just pull up some. I'm going to just go on very quickly. I know that we're pressed for time, and if you have any questions, you absolutely will try and answer them as well for you. For those of you that might have colleagues that are new to or returning vaccinators, and they actually need a training pod, we're setting up one training pod within every locality within Greater Manchester, with Manchester North, Central and South each having one of their own training pods. The idea of the training pod is that actually those individuals that are new or returning to vaccinations would actually need the IM training, and also to be observed and have their immunisation signed off. So that's the whole idea of the training pod. Within the training pod, we're actually supporting a paid role of a nurse lead immuniser of 1 day a week for 12 months. And we hope that that nurse lead will then support not only the COVID vaccination programme, but the wider immunisation programme that Jo and her team lead on. So that's just kind of in case you might have anybody within your practice that maybe would go down a different pathway than you. So if you're experienced, you would complete your certificates and progress straight to an approved passport. If you're new or returning, there's a couple more steps that need to be completed in order for you to get that nice green tick. I'm going to stop sharing my slides there and to see if there's any questions that I need to pick up on in the chat. So the slides will be shared, and what I would say is that on the last page of the slide there is a link for you to either register or for you to update your passport. We're hoping, obviously, there's lots of information that comes out in one go, but the passport's really well placed that when there is new training, we can automatically contact you. There's we can update the passport with the new link to the training. If there's a new vaccine, as Jo referred to before, the new vaccine that's coming online in spring, we'll be able to send you a direct notification. So it's a great way to keep all of your information in one place. If you're going working in other sites, you also pretty much turn up with your telephone, you bring up your passport, there's a QR code in there, and you can prove to that particular site that all your training is updated, and that gives the site a real sense, of assurance that all that training has been completed. I think I've probably just about give you a whistle-top tour there, so hopefully you might be able to go and get a cup of tea.
Thanks, Kerry. There's quite a few messages in the chat, but we could answer them later and send that out if that's okay with everybody. Yeah. Because there's a lot of questions asking for websites and contact details. We'll get that out to everybody.
Yeah, no problem.
At the end of this session, thank you. Thanks for that. Really great resource there. Thank you. We'll move on swiftly now because we have missed our break. So I'm really delighted to welcome our next guest, a busy community nurse lead, Queen's nurse, and the Northwest lead for the Chief Nursing Officers BME Advisory Group. Jillie's kindly taken a time out today. I know she's COVID mad to come and discuss inclusive leadership with us. Thanks, Jillie. Thank you.
Hello, can you see me and hear me?
We've just got you there, yeah, we've got you, Jillie.
Excellent, I'll just wait for the presentation.
Is this voluntary work or will we be paid for each shift? Yeah.
I think Claire's sharing it for me. Lovely, thanks Claire. So and thanks Leslie for inviting me today. It's brilliant to be here. Really appreciate the time that you've given me on the agenda. So I've been asked by Leslie to talk about inclusive cultures, and I think it's probably because we are doing some work together around the care leadership programme. So I'll give it a go, and we'll see where we get. But it's really good to be able to share my views with you. Next slide, please. So I think for me, the thing that I often go back to is the NHS Constitution. I think really why I go back to that is because for the NHS Constitution, you know, it really states what we should be about, and that it belongs to all of us. But I think it also sets up a question really, and that is if we think about that as people that we serve or those that are being part of a team, I guess I have questions if it really does belong to all of us all of the time. Next slide, please. What's also really important to me is lived experience. So I'm here today talking to you as, I guess, someone with lived experience rather than expert in inclusive cultures. And I think what I'd like to do is just to tell you a little bit about my journey, a little bit about why this area is really important to me, and why that inclusive cultures as part of a team is crucial to patient care. So my father's from a place called Tiki Tiki in Jamaica, and it's Manchester, and that's where he's from, the province of Manchester. And I think, like many people here, we were weaned on stories and narrative, and how that influences. And what became really clear was how he used to have to use the state of Manchester on his CV to apply for jobs. So he would put that to get a step in the door, because he didn't probably have as much opportunities as others when he'd used the fact that he was from Jamaica. So that was something that he learned, and that's what we were brought up on. Next slide, please. And, you know, we've moved on a bit since then, but certainly when Mr. Lee first came over to Liverpool, he experienced you know, signs and was turned away from businesses, from guest houses, because he was coloured. And that's the experience, and that's our stories that we were weaned on. And this is probably familiar to a lot of you. You know, it's you know, very much in the media, and we're not as scared to talk about these things now. Next slide, please. I think also what's important within inclusive cultures is that it's recognising the intersectionality of different protected characteristics, you know, whether that be your race, your gender, your class, your sexual orientation, or your ability. And I think why I've put that in is that actually, if you're looking at people that have multiple, you know, overlapping identities, that, you know, it can also have an impact on how you have come through in your journey within the system. Next slide, please. But why have I led in with this? And I think this is something that's really important to me, is that you know, rainbow families is you know, we've talked about rainbow today as being the health and the NHS and all in this together, but rainbow families means something to other people in other communities. But the reason for me also, I take from a comment that I heard, or an experience that I heard around, it's really about our grandbabies, and that's the Inuit way of looking at things. So we're looking at the future and trying to change our inclusive approaches, not just for us, it's for our future really. Next slide, please. So when I think about diversity, I also think about, am I thinking about different types of diversity? So when I think about neurodiversity and being included, I guess somebody who has the lived experience of living with dyslexia and dyspraxia, I guess for me it's really important that you know, we are representative of all our differences, and the asset that might bring is the thought diversity within those teams, and we might touch on that a little bit later. Next slide, please. And I can't help but mention what really is my lived experience and absolutely crucial is how we might look at widening participation. So, you know, I left school with no qualifications. I was fortunate enough to get into nursing through an entrance test, ended up getting two masters, and now in working with the regional team around with the Chief Nursing Officer, BME Advisory Group. And one of the things that is really important is how do we enable that career development and career journey for people? And it's because of my lived experience that kind of lights a fire in my kind of belly to promote that. And for me, it's about raising that as a thought and a question within your teams. So next slide, please. So I think we've put the case for change. This is well established now. I hope that this isn't a surprise to you, but you know, we look at quality services, the case for change and inclusive cultures, it's there. Services of quality, nursing is built on quality care, health and social care. Ethically, it's the right thing to do. If we're talking about staff satisfaction, you know, Michael West would say that BME, the satisfaction of BME staff would be a barometer into satisfaction of all staff. And if we can just move that 1 point on standard deviation, it would really, really enable a financial efficiency to make within the NHS system that we could reinvest. So this is also about the financial case for change. And I guess it also is about lifting our whole population's health. Next slide, please. Next slide, please. So apart from being accessible and the equality duty and the legal standards around being inclusive, you know, those are things that we do have to face now, and we're working very hard on working across different systems to make sure that we're collecting that information and acting and shaping our systems. Next slide, please. But I guess there's a little bit about getting comfortable with the uncomfortable. So I want to pose to you and for you to just have a little bit of a thought in your community teams, in your practices. I'm interested in who's sat at the table, who's having the conversations, who's influenced and who's invited. But then not only that, it's actually not just being invited to the table, it's being able to speak up, being able to be included, being able to act and participate in developments that are going on at your level. So that's really a question for you as leaders within Manchester and Greater Manchester. Next slide, please. So if we are going to have these uncomfortable conversations, I guess it is really important that we recognise that as far as our population goes, and we are our population, that not everybody starts at the same point, whether that be any protected characteristics. And I guess there's something about being able to have those conversations and not necessarily seen as it's being someone to be fixed or a deficit view on this, but more an organisational change, a cultural change into inclusive cultures. So, you know, we need to start to have those conversations or continue to have them. Next slide, please. And there came a big point as part of pandemic. I mean, I haven't mentioned pandemic and the disproportionate impact upon BME people, but also as we continue, you know, trying to make sure that our services, our campaigns are tailored with all the protected characteristics, whether that be disability or BME or race or whatever protected characteristics. And I think that time for change was only enhanced with the recent Black Lives Matters and what all the aftermath of that. And it really sparked a change within our national and international landscape. And I think it's taking that and harnessing it and working with it. Next slide, please. So, you know, I imagine if I said to a group of people, you know, how would you see yourself as being an anti-racist organisation? Because this isn't about people, it's about the system and how we change that system. I would imagine that if I'd have used the term anti-racist, there might have been some prickles or some sharp intakes of breath, because it feels uncomfortable to talk about that, to actually diagnose that and using that diagnostic. However, I'm now part of groups and you know, working groups to talk about anti-racist strategies within organisation. We're looking at that, we're working with that. But I guess it's about where do you sit currently. So what you'll see on that slide there is quite an interesting diagnostic. It's for you to look at whether which zone you would sit in yourself and how we can work towards an anti-racist organisation. Next slide, please. But let's not also you know, let's also recognise that, you know, inclusive cultures is built on evidence. So we know that demonstrable leadership and direction changes, you know, data to around inclusive cultures. We know that mandatory metrics. So we have the workforce race equality standard, and we need to change the gaps on that. And metrics that are managed will make a change. We know that consistent and persistent messages and comms and the positive depiction of difference within those helps, and the evidence demonstrates that. We need resources and role models, and we need to celebrate and highlight success. So that's what the evidence tells us to how we can shape the data to inclusive cultures. But there's also space for innovation. This stuff that we haven't done yet, and open to ideas. And I think that's really important to have that space for design as well. Next slide, please. And then it's how do you do it? So we would ask, it's not necessarily people with protected characteristics who need to do all the work. It's all of us. I think we've already heard that we're in this together if we really want change. And I think it's having these things like don't assume and seeking views, taking action. We've done a lot of talking, so we want to have some action. If we have to do another consultation or an engagement exercise or get more data around more challenges, you know, that becomes unpalatable. So let's have some action. Let's do it together and co-produce it together. And I guess initially that accept that there is a problem. You know, what's the data saying? There's the workforce race equality, for example, which is the numbers around the standard, and then there's the stories and the narrative, and the narrative does change, and I have seen changes over the last couple of years, but there are still some stories and experiences that, you know, that would make us all very uncomfortable. So we do need those allies, and I ask you to be an ally to those staff with differences, and to promote inclusive cultures. Finally, I guess that diversity of thought, what we know with diversity thought around the table is we know that we get more from it. So enjoy the fact that, you know, we're going to have challenges and differences of opinion. I hope that you have environments that promote that psychological and cultural safety, to have those conversations, to ask why, so we can get change. I don't know what inspires you to act, but for me, certainly at times it's when I'm curious. We've all heard that. But I must say, if I'm irritated or frustrated or equally excited, that's another way that promotes me to act. So whatever it is, and if there's terminology that you're not familiar with or you're just slightly curious, I hope it has left you with that to go out and find more. Next slide, please. He's stuck. Are we stuck, Claire?
I think there must be a delay. It's changed.
Mm. Okay.
It's changed.
Next slide, please. Next slide, please. Are we stuck, Claire?
I think there must be a delay. It's changed.
Okay. Next slide, please. Next slide, please. I think it was the last slide, wasn't it, actually? I'm sure it is the last slide. Yes, it is the last slide. So thank you very much, and questions really, and I'm sure it'll come up at the end there. But yes, it is a challenge to present to a Teams meeting, but I'd love to have any questions.
Thanks for that, Gilly. Lots of thought-provoking presentation there. Oh, that's great. Your contact details are on there. Are there any questions for Gilly before we move on? I think you might have got off with that one lightly, Gilly, today. But thank you very much. Your contact details are there, and the presentation will be sent out to everybody.
Oh, there a hand up there? Oh, no. Okay. Thank you.
Thanks very much. Thank you. Sorry, we've had to move the agenda around a little bit today. So I'm going to press on now and introduce Karen Story, so that we can move on quite quickly. So I'll let you take it away, Karen. Thank you for coming today. Thank you.
Thank you, Leslie. And hello, everybody. I'll introduce myself in a moment when I've just got the slides up for you. So, oops, sorry. That was a move on my part that let's try that again. There we go. Great. And let's just get that on slideshow.
That's great, thank you.
We're all learning new skills, aren't we? Whoa. Can you see me? Yeah. Oh, sorry, can you see the slides, Leslie?
Yes, we can see them.
Yeah,
thanks,
great.
Karen. Yeah, thank you.
So, hi everybody, I'm Karen Story. I'm Primary Care Nursing Lead at NHS England, NHS Improvement, and my role sits within Ruth May's team, the Chief Nursing Officer for England, to ensure that there is representation for general practice nurses and primary care nurses as a whole. And a special thank you to Gilly. Gilly, thank you for that great presentation as well, because I love your theme and message around being curious. And that's a really good thing to be, especially at this time. So I've been asked to speak to you today about the care programme that you're about to launch in Greater Manchester. But before I do that, I just wanted to say a big thank you to primary care nurses and general practice nurses, community nurses, all nurses that work outside the hospital setting, for your work that you're doing at this time. And on behalf of myself and from the CNO's Nursing Directorate team, just a big thank you for all you're doing. And it's great actually to be part of this great work, this great effort around COVID vaccination, as I too have joined a local primary care network vaccination team, and it's been great to work with them as the weeks have gone by. So before we go on to talk about care, I think it's important that we sort of get some context around why we need to look at this care, which is a bespoke leadership and resilience programme that we want to offer to you in Greater Manchester, because we are in unprecedented times. These are really challenging times, and actually we want to be able to equip you with some key tools that you can use to get through these times. So I just wanted to start with a story, as Gilly had done, around why leadership is important to me, and using my own example of my leadership journey. So I started out here as a student nurse back in the 80s, where we did things a bit differently then. I started out as a student nurse in the 80s, and the great thing that happened to me was that I had a placement with a community nurse, and it was that experience that helped me realise that I really didn't want to work inside the hospital. I wanted to work outside of the hospital, and so I took up a role as a newly qualified nurse in general practice in a primary care setting. It was a different setting, it was a military area, but nonetheless, I learnt my primary care nursing skills from the outset, and they've stayed with me along my nursing journey. And when I moved into general practice, then there were some great opportunities. I worked in a variety of practices, and in one particular practice where they really invested in leadership and development, I really excelled, and I know that that was a great opportunity for me then. But equally, I reached a ceiling in my development, and unfortunately I had to leave general practice to take up a clinical leadership role in an NHS walk-in centre. And for me, I always think that that's springboarded my career. There's opportunities to do a master's in healthcare. I looked into nursing leadership as part of my dissertation. And it led me into a career where I took a real interest in looking at the workforce, our general practice nursing workforce, and also to be able to influence the policy that applies to general practice nursing. So I had contributed to various policy documents. And then finally, in this role as the primary care nursing lead in the CNO's team, to be able to deliver and act out with Paul Vaughan, who's the head of general practice nursing, the general practice nursing 10-point plan. And it doesn't stop there, because by having connections with other people, that we've brought about some great opportunities. And I just wanted a quick plug of a book that we're writing in collaboration with some general practice nurses in the field. It's called A Nurse's Survival Guide to General Practice Nursing, and we're going to publish next year as a collaborative effort, and all the proceeds of the book will in fact go to the COVO Nursing Trust. And the reason why we've done this is because of hearing of general practice nurses who are accessing the hardship fund at this time in this current situation. So all proceeds will go to the COVO Trust. So what does leadership mean to me? Well, we all have thoughts and ideas about what leadership really is, but for me, it's quite simple. It's about this quote sums it up nicely for me. So leadership is not about titles, positions, or flowcharts. It's about one life influencing another. And actually, we might ask ourselves, well, what is influencing? So it is about behaving in a way that offers others an invitation to change. It's about building relationships to recognize other people's passions and concerns. And it's using interpersonal and organizational understanding to persuade and build collaboration. And that's what we need at this time. Collaboration, coming together in our teams as we start to work differently to deliver the COVID vaccination for the population. And so I always think that leadership always starts with self. And there's a key message here that I think you've probably heard as a theme going on today, that it is important to actually take some time to reflect and look at yourself to see how you're managing in this current situation. Lots of demands have been made of us as nurses to give to others, but actually we can't keep giving to others if our emotional cup is empty. So I would suggest that, take some time out, really ask yourself how you're coping at this time, access some of the resources that are available. And actually what I've done this slide is put some evidence here, which if you want to have a look at, the emotional impact that nursing can have on us as individuals has been documented and written about in the past. And so there is evidence to support this. So how do you access resources to look after yourself? Well, I'm sure you've got plenty of resources in Greater Manchester. And if you haven't, and you don't know where to get them from, then look to the NHS England website, because there's a national offer. The hashtag Looking After You Too is available as a coaching offer. There are lots and lots of resources there online for you to be able to access at this time. And apps. Now, as part of the CARE programme, you'll be introduced to a Shiny Mind app, which I've been using for a number of years, and actually there are some fabulous resources on there, but there are many other resources and apps available, and here's just a few of them. I was at a conference last week where I was introduced to lots of different apps that are available, some that I didn't even realise were available, and so they're all summed up in this slide here for you to use. So, as part of the General Practice Nursing 10-point plan, we have focused on leadership. Now, the General Practice Nursing 10-point plan has been a 5-year programme, which many of you will be familiar with, and it's a national policy that supports the development of general practice nursing. But the 5-year programme is coming to an end, and we finish the programme in March 2021. But it doesn't stop there, because we do know that there's lots more work that needs to be done to support general practice nursing. But leadership has been a focus, action too, and we've focused a lot of effort and energy on how we build leadership within general practice nursing. And that's something that I'm really passionate about, because in the story that I told of my particular journey around how I had to leave general practice in order to take up a clinical leadership position, that's something that I'd really like to address, because we don't want our most valuable members of the workforce to leave in order to take up clinical leadership roles elsewhere. I firmly believe that we should be able to ensure that general practice nurses have opportunities to ensure that they can lead within a profession that they love. So we'll be looking to work with our teams in the regions to ensure that the legacy around leadership and the care programme continues. So what have we done? So we're starting right from how we support our students to have placements in general practice, to take up leadership positions in the future. Our general practice nursing student nursing network is vibrant on Twitter. If anybody wants to follow them, you'll hear from students that have had really positive experiences in general practice, and they want to share that experience with others to encourage them to become students in practice and newly qualified nurses. We've also looked at how we might be able to work to deliver a different type of national offer. So we teamed up with the Leadership Academy nationally to deliver the Rosalind Franklin General Practice Nursing Programme. So this started out taking the core Rosalind Franklin programme and bolting on some additional requirements that we felt that were needed for general practice nursing. And we haven't stopped there, because our executive nursing leaders who are clinical directors of primary care networks have emerged. When PCNs were first launched back in 2019, we heard from 18 clinical directors who were nurses that had become leaders in their primary care networks, and that was an absolutely fabulous thing to celebrate. And I personally celebrated that, because that gives us our first executive nursing leaders from within the profession, which is a great thing that's happened. And so what is care? So care is taking on board all of those things that we've learned through the GPN 10-point plan, looking at our experiences from working with the Leadership Academy, and then thinking about how we might deliver a different approach to leadership that tackles some of the requirements that are needed to deliver the NHS long-term plan. So again, back in 2019, when PCNs were first set up, we heard from those executive nursing leaders who'd been made leads of primary care networks, but we also heard from general practice nurses who told us that they didn't know what primary care networks were or how they could get involved. So it was actually a conversation on Twitter one weekend that myself and Hilary Garrett, the Deputy Chief Nurse, had with a group of general practice nurses that then led to a series of listening events that we had around the country. So we heard from general practice nurses three key things that have helped us develop the care programme. Number one was that they didn't really understand what PCNs were. They hadn't heard of them at the time. They didn't know how they could get connected to PCNs. Secondly, they really felt that they couldn't be leaders in primary care networks. And thirdly, they didn't understand population health management. What was this thing, population health management? Even though I know that general practice nurses deliver and community nurses deliver population health management as part of their core role. So once we heard from the systems around the country, we looked to engage with the National Association of Primary Care, because that being the experts around population health management, we thought that they would be a great organisation rather to collaborate with. And we also looked to Beck Howard from Shiny Minds, who'd done some work with us through the Rosalind Franklin programme and had fabulous results around helping nurses to release their inner leader. And we brought those things together to build the care programme. And what we've found is that by making this part of the GPN 10-point plan, again, it's about a legacy to the general practice nursing 10-point plan programme. So beyond that, care can continue to enable and support general practice nurses and other nurses, because we haven't just stopped at general practice nurses. We've looked at the wider nursing family outside in the community and primary care outside of hospitals. And so what is it? So we've used those three principles for leadership development through practical projects. We've enabled the general practice nurses on the programme to think about a project that they could lead and develop along as part of the programme that will make a difference to their populations. And a core part of the framework of care is around partnership working. So we've brought the system to and wrapped it around the nurses on the programme. So it's not just about nurses working in isolation to deliver a project and not knowing where to go to build connections and to have it embedded in their primary care network. It's about ensuring that we get the system leaders to work alongside the general practice nurses on the programme. And a core part of the programme is around the leadership development. So starting with self, how do you approach and deal with things on a daily basis? Understanding why we do the things that we do. And as Beck has demonstrated by working with our general practice nursing leaders and with myself, that it all starts right at the beginning, probably in childhood, will determine your future as a leader. So working with one system in Nottingham, I just wanted to share with you the success that we've seen with working in the system in Nottingham. So as you can see here, with some great feedback, 93% of participants felt that it had really improved their emotional well-being, and that they felt, as their voices weren't being heard previously, that 100% felt that they now had a voice and were part of that system, and being at the table was key to that. It's had an impact on patients, some great feedback here around what that care has been able to impact on individuals to deliver their projects, to make a difference for patients in their community. And care has also helped build their profile, general practice nurses' profile within their teams, not just their immediate teams, but within the system as well. And I'll leave you with some quotes here from individuals who've been on the care programme. So it really has impacted on individuals' personal lives as well as their work lives. And there's some great quotes here that I'll leave you to read. So what are we trying to do with care? This is about a vision. So starting with a vision of where we want to get to with general practice nurses, and not just general practice nurses, but all nurses outside of hospital. This is about ensuring that we have connected, authentic, resilient and empowered nurses who feel fully supported, valued, empowered and connected around a common purpose to deliver proactive and personalised care. That's our mantra. And we deliver the national ambitions that have been set out in the NHS long-term plan and the people plan. So thank you very much for listening. I hope you will be able to take on board some of these things that I've mentioned, and if I can help in any way to connect you as participants of the care programme, if you need connections or you want to connect with me on Twitter, happy to do that. And our aim, as I say, is to build connected, authentic, resilient and empowered leaders. Thank you very much.
Thank you, Karen. That was excellent. Thank you. There are some questions in the chat around retention and around career development and professional development and career growth. I appreciate that you've got little time, Karen, to spare for us. Yeah, you know you've got to get off. Sorry, today, but I feel that the care programme sums all that up quite nicely. And I don't know whether people that are on the meeting today actually know that it's going to come out into Greater Manchester, and that we're going to have 67 places for nurses across Manchester to be involved in the programme. So we've put some details in the chat, and hopefully people will log on to the website and read more up about it and get involved with the care programme. I don't know if there's anything more that you want to add with that.
No, that's fantastic. It's fantastic that Greater Manchester is supporting primary and community nurses on this journey. And as I alluded to there, in Nottinghamshire, although we took funding from the General Practice Nursing 10-point plan to support general practice nurses initially, they quickly realised that they wanted to offer the programme to community nurses, to care home nurses. So, you know, really think about how that model could actually work for your area as well, because it's a great way of forming collaboration, of breaking down barriers, you know, so that people don't feel that they're working in silos and they can work together as a team. And I think that's another key message that's been delivered through your conference today. It's around working together as a team. We're all in it together. And it's a fabulous thing to bring people together. Thank you, Leslie.
Yeah, thank you for coming, Karen. Thank you very much.
Take care. Enjoy the rest of the day. Thank you. Bye.
Unfortunately, I mean, time's pressing on quite a bit now, which we've overrun by. So what I'm going to do is ask if we can just leave the healthcare support worker update until next time. We will send the slides out, and we want to give it justice. So we'll do a longer slot next time at the next meeting, if you don't mind. And we'll move on to Kate's final session, if that's okay with everybody. Thanks, Kate. Thank you.
Oh, thank you. I feel a bit rude if we've bumped somebody off the list, but great. I've literally got a couple of minutes. If you've got a couple of minutes to spare two things I just want to say is I've sent Claire the QR codes for the 2 videos that I sent around. So Hope at Work and Joy at Home. You can either Google those and put them straight into YouTube, and then the 2 animations will come up. And the other thing is, the Resilience Hub address has just come up there as well. But again, straightforward, Google Greater Manchester Resilience Hub, and the wellbeing link is in the middle of the page there. Okay, so just as Karen said, we're back to wellbeing. Obviously, caring professions are kind of one of the most at risk of burnout if we don't start thinking about our own self-care. So in the last couple of minutes, again, I'm going to just talk you through a really short practice to give you just a sense of how short a practice might need to be to impact just on your kind of physiology, really. So for those of you who've got the time, if you can just turn off the chat and reduce any extraneous noise and interruptions where possible, just any disturbance over the next couple of minutes. And we're just going to do the same preparation again. And for those of you that just want to dip in and out, that's fine. Or feel you don't want to take part, that's also okay too. Or if you're taking part and feel you don't want to take part anymore, that is also absolutely fine. Okay, so if we're sitting for the last few minutes together, I'm just going to suggest you take a couple of really lovely deep breaths, just to really ground yourself in the seat that you're sitting in. Really filling your lungs and noticing that air kind of taking up that space. And as you're letting out that air, by all means close your eyes if you feel you're able to, or just lower your gaze, look at a really small object. Let's just look in a fixed place for now. And then take another nice deep breath in, slowly letting it out again. May mean that you end up yawning. Taking a deep breath, just having a bit of a move. And I'm going to suggest you just bring your attention to any tension that's built up again while you've been sitting for so long. So really noticing your shoulders, your neck. Quite often carry a lot of tension in your jaw. And in your next breath, just see if you can release that tension. Release that tension, and then just let your breath return to its own natural rhythm. No need to do anything more than that. Just let your breath be there. And if you want to really connect with the movement of your breath, you can put a hand on your chest or a hand on your belly. And just really notice the rise and fall of your body as your breath moves in and out. Just feeling the natural rhythm your breath can create, remembering that our breath's always there for us to come back to. Always there as an anchor. And as you come to the end of your workshop today, getting ready for the rest of your day, whatever that may be, maybe a clinic, maybe going back to being a parent, doing multiple things at once, I guess I just want you to turn your attention to what you might take from the last couple of hours. This time of coming together, of online connectedness with colleagues. What will you take with you going forward into the rest of your day today? And if there was a message of support you could give your colleagues to take forward with them for the day, what would that be? What might that sound like? What message would you want to give your colleagues going forward for the rest of the day? Perhaps a message that reminds them of their strength and their commitment to their work and their compassion for those they look after. Maybe a message reminding them to extend that compassion towards themselves, reminding them that they can do no more than the best they are doing right now. Bring this message to mind now, and as you do so, bring your attention back to your breath. And just bring that message while you're breathing, and see if you can anchor that message in your own breathing. And perhaps as you go forward to the rest of your day today, this message can be something you can return to when you need to. A message of support to yourself that is anchored in your own breathing. And it may be that you need to put your hand on your chest when you remember this message. It may be that you have your hand on your belly, or maybe that you can just bring this message to mind as you breathe. And now, as we begin to end this practice, with this message in mind, just come back to your breath. Come back to your anchor and just slowly take some longer, deeper breaths as you start to emerge from this practice, letting your attention expand out to the rest of your body, to the sounds in the room, maybe starting to move your fingers or your toes. And on the next breath, opening your eyes, having a stretch or yawn. And slowly bringing yourself back to this moment, ready to move into the rest of your day. And when you're ready, that's us done. And I don't know if Leslie has more for you, but our details are on the screen. If you need anything from us, we are here till 6 o'clock. During the weekdays, apart from Fridays, if anybody wants to get in touch. And we have quite a few resources on our website as well about self-care, taking care of your kids, working from home while trying to homeschool, all the kinds of things that a lot of us are juggling with at the moment. But thank you very much for your time. Thanks, Leslie. Thanks for the invite.
Thank you, Kate.
You're
Thank
welcome.
you, Kate. That's excellent.
You're
We all
welcome.
really enjoyed that, I'm sure. Thank you.
That's okay.
And thank you to all our speakers today for joining us, and everybody that's attended, really. I know you're incredibly busy, but thank you for supporting us. We really hope that this quarterly forum will go from strength to strength and become a platform to showcase not only the best of nursing in Greater Manchester, but will keep you all connected, informed, updated and inspired. Thank you all again. And if you'll put in the chat any feedback you have for us, that